Okay, so you made it, Conquerors. Welcome back to Device and Conquer. Today, we're wrapping up our first season with a bang. So today, we are going to pay tribute. It's part manifesto, it's part wake up call for the rise of the regulatory rebel.
Oh, it starts with you. I waited. It was such a good opening. It started with you. Okay. Rise of the regulatory rebel. What do we mean by that? So let's be real. Regulatory affairs is a department that is typically seen as a no man. They're the police, the people who kill ideas, they block
Yeah.
launches, they make fights with marketing. They're the no men.
One of my bosses used to call me that, or used to tell me he was going to get me a sign for my door that said business prevention expert.
Which, I mean, it's tough because that's, you know, being a modern day, regulatory person, we have to change that, right? Like the department isn't built to say no. They're not here to be party poopers and get everyone all worked up or get you being like with the big red, you're going to go to jail if you do that. We need to change the image and rebrand regulatory personnel and
Mhm.
you know,
Well, and it comes down to the company culture.
yeah.
When the CEO is telling regulatory that they're business prevention experts, what do you think the culture is? How do you think the rest of the company treats the regulatory department? And you're definitely not thinking about how can it be a strategic and competitive advantage to get me ahead. And
Yep.
an example of that is this same boss. So way back, I'm dating myself here, when Reach first came out, which required all kinds of chemicals to be listed, and you had to have things on your labeling and special signs and whatnot. And one of those was phthalates, and this company made a huge amount of flexible PVC to like nasal tubing,
Mhm.
masks, all kinds of things, all loaded with phthalates. And it was about a year before that it was going to go into effect, and I'd started telling him like maybe every other month at first, and then I started telling him every month, then I started telling him every week, and he's like, fine, bring me this regulation where you think it says that we have to either get rid of phthalates or list them or whatever. So I brought it to him. I had highlighted the paragraph where it was very clear that phthalates were included. This is what you had to do. And he started screaming at me, and he called me illiterate. He said, "You can't," and he read out loud the sentence I'd highlighted, every other word until it said what he wanted it to say, and
Oh,
not how it actually read. And he said, "Thanks, Michelle. You just cost me $700 because I'm going to have to hire a lawyer because you can't read." And then, so you fast forward to 1 month before implementation. Side note, there are 2,800 product codes that contain phthalates at this company.
whew.
1 month beforehand, one of the biggest medical device companies in the world was a customer for the cannulas. They said, they called them and said, "Hey, John, we just want to see, that you're done with the reach transition plan for the products that you're supplying us, because it's going to go into effect next month. So we assume that you've completed it." And so in 1 month, this crazy man expected us to transition 2,800 product codes to a new material, which meant new validations on all the presses, all the equipment, on all the dipping machine or dipping stations. It
Yeah.
meant new biocompatibility, new flow rate, flow testing, like all of that. in a month. It was insane.
Yeah,
So,
I mean, you probably couldn't even sleep. And I know, I mean, having that many products, there's no way that you met that deadline. I'm assuming you probably had to pick and choose and prioritize and cut serious product lines. I mean, that just isn't feasible for companies.
but
And
but it wasn't until the customer,
yep,
a multi million-dollar customer, asked, where is your regulatory compliance, before he even acknowledged that it was a real thing. And we could have been ahead of this. He could have been selling to all the other big people of, hey, we're done with the transition already. Come on over. We're going to make this easy for you.
yeah, totally. I mean, there is a culture and people kind of fall in buckets, right? There's proactive compliance that companies pursue, and there's reactive compliance that companies pursue, right? So as regulatory professionals that pride ourselves on being strategic, on finding how we can move companies forward to get good product to patients and help, diversify the market so that you have really good alternatives and cutting edge alternatives. You have companies like that get stuck in this reactive compliance loop where they just don't embrace the reality of where we are from a regulated world and a regulated organization. I see challenges like this a lot when you have companies that are new to med tech, but they were successful in commodity, or who were really successful 20, 30, 40 years ago and don't realize how strict the regulations have become since the last time that they did it and they had an exit.
Or think
Right.
about this one, when, and I will name names here, when companies like Philips, that
Mm.
used to be toothbrushes and TVs, even though toothbrushes is a medical device, I'll give you that, all of a sudden decides that the healthcare market is much more stable. And then they take all their know-how about TVs and go build ventilators. And now you fast forward, and we have had some of the biggest ventilator recalls of all time. Like, I think they literally might have recalled every ventilator that they've ever made recently in this
Yep.
past year.
It's it's definitely a challenge, right? Because we see, and I've seen this too, where people try to cut corners by hiring personnel that don't have medical device experience. So they say
Mhm.
we'll get as good as we can get, and someone who's got food experience or automotive or uh,
Yep.
aerospace is good enough, and they don't understand the requirements. But there's this, at a deeper level, there's this kind of, I would say it's more old school to be reactive to compliance. You wait and wait and wait and wait and see if you're going to get punished, right? And working with startups, it's so challenging to sell proactive compliance to them because they say, hey, Philips is doing that, or Stryker is doing that,
Mhm.
Medline is doing that, and I want to
So it
do,
must be okay.
so it must be okay. And they don't understand that either something got overlooked at that organization or they can afford the fines. They can afford to get in trouble because it's a drop in the bucket of their revenue
Yeah.
compared to pulling that product off the market or waiting for a proper submission. And
BSC got fined like $5 million one year by the FDA. They don't care.
they don't
That,
care. It's
that
it's not
they
even,
have that much of scrap probably on one facility
yeah,
around the world, a day.
exactly. Like yeah, they probably don't even, it's probably a write-off in their books
Exactly.
at one point. And so you have companies that have, either they did it wrong or they can afford to eat the fine, or, sometimes it's just gets overlooked in audits. We know that audits are based on sampling. They can only dig as deep. And when you have a company that has hundreds of employees and then it gets to thousands of employees and thousands of product types, they're going to get the same amount of audit attention as another company. It's not like because you sell more, you get more audits. You know what I mean? Even if they're EU ISO certified and get an audit every year, it's not like they're auditing every product line,
Right.
every year, all the
Hmm.
time.
Hmm.
Thousands of records are being created.
Yep.
So things just end up being missing, right?
So let's back up to the term of regulatory rebel. What are some of the things that you imply about what it may mean?
I think being a regulatory rebel is about reading and interpreting regulatory rules, but questioning why they were like created or implemented, right?
Right.
So it's about
What is the
understanding
intent and not the letter?
exactly. It's about understanding the intent of what's being asked. Our job as regulators is to take what FDA publishes as their current thinking and interpret that into a message of action for industry. That's what it means. And it's got to be a compromise
Mhm.
between what FDA wants and like the theoretical, almost academic approach that they have because they're not boots on the ground. And when industry wants to be like, the world is ending, I cannot afford this validation, everything is
Yeah,
going to the end the company because of the budget.
yeah,
We're this middleman that has to be a rebel that says, okay, FDA wants a little too much, but you need to do something here.
yeah. They're telling you we're gonna have to move somewhere. We're moving away from this, period.
Yep.
And you know, every regulation, every guidance document, they all come out in draft before they're
Ugh,
published.
the
And
giraffe.
uh, dude, how many times, Ty, have you heard a customer or a team member say, "What are those magic words?"
It's a draft guidance. Do we need to follow it
That
yet?
means it's not a requirement.
It's not a requirement. It's a draft. It's a guidance. I'm not sure this is in the best interest of our strategy right
Yeah.
now.
So there are two things about that. First thing, the FDA is telling you what their current thinking is, whether it's final or published or not. And so if you don't at least acknowledge what they're thinking
Yep.
or be aware of what they're thinking, you can't plan around it. You won't be prepared to respond to it because you're going to get questions in your submission that are, if you had read the draft, you would see where the question came from, where the thinking came from.
I mean, software was notorious for this, right? Up until about I don't know, 8 years ago, 7 years ago, the only way you knew what requirements FDA had behind the scenes for software submissions was if you were doing them.
Mhm.
That's really challenging when you only might do a handful of submissions a year. They only get 2,000 510Ks a year or something like that. It's not as many as you anticipate. And then they did a really good job of publishing all of these draft guidance documents, but then people kept considering them as drafts and didn't want to interpret what was out there. And as a regulator, it's so frustrating for me to have to explain like they're doing that because FDA has this kind of culture of not being able to make a committed decision unless it's in a review and they want to say that everything is just for your interpretation and that it's not binding but the reality is it is binding. They
Mhm.
are expecting that
You're going to have to talk about it
at the
and
very least.
address it one way or the other.
Exactly.
So if you don't do it, you need to talk about why you didn't do it and what you did instead and why you did it. And you need to be in control of that information and dialogue to be successful.
And that's strategy. People don't see that as strategy, but it is strategy to know, okay, FDA's published this. You really think that you can't address X, Y, or Z, or you need to address X, Y, and Z in a different fashion than what's conventional. Let's talk about that. Let's talk about the risks in doing that, and let's talk about the strengths in doing that and how we position that to make sense for the FDA because they're looking from a perspective of safety for the patients. Safety and efficacy, that's what they care about. So we need to tell them that story and be confident and correct in saying, hey, here is our safety and efficacy data. We are doing everything by the books and we're doing this right,
Mhm.
you know.
And Ty, the second part of the whole draft guidance document is because they give you an opportunity to comment, you have a voice before they finalize it. You can say, this line item, I disagree with, and this is why.
Yeah.
Or I agree with this, and it needs to also include these other things. So if you're not using your voice to help FDA towards the formalization of their thinking to make it maybe that, like you said, that kind of more middle ground. To me, this is like having a problem with the presidential administration, but you didn't go vote. And
Yep.
so if you're not going to go vote, if you're not going to make your voice heard, if you're just going to sit there and say, I don't want to do that, FDA, that's ridiculous, and just complain, but not be part of the process to make it different or better, how is anything supposed to be, it's supposed to change or be useful, what is coming down the pipelines?
Yeah, and as good regulators, what we do is, I mean, you get 60 days to comment to the federal registrar, and Michelle and I have done this. A couple years ago, HHS put out a down classification that we had very strong feelings and disagreements with, and put out a campaign to industry, trying to downgrade very high risk products that didn't have any mod event data because there weren't any commercially available, because the requirements were so high as they should have been. But it's important to know that you can work with your regulatory team when things are freshly published in draft to do that comment period. And you owe it to, help FDA understand industry's perspective, because a lot of them don't necessarily get that experience or quickly get removed from it. Or maybe they've only worked at a huge company and they've never seen what it's like when you don't have a seven-figure budget to do biocomp, right?
Mhm.
Like that's just not a reality for a lot of small businesses.
In that particular example that Ty talked about, where we had filed the petition in response to the suggestion to downclassify all those really high risk devices, we had created a chart, and we had a reason for if we agreed or not, what we thought the classification should be, and a comment. And the FDA literally quoted out of our petition in the reason why that they chose not to accept, why they were rejecting what HHS had submitted.
Yep.
And they said, as one commenter wrote, and they used our
Verbiage.
information as reasons to stop in that case, that one was a very unsafe bill that would have led to public safety issues. So, but at the heart of the argument here is that the competency level of the regulatory personnel, especially as more and more regulations come out, you can't be a letter of the law person. You
Yeah.
can't just read this and just follow it to the T and try to shove it down your engineering team's throats. You have to really back up a level, sometimes up to a policy level, and look across policies, look across unwritten policies that you just get from looking across projects and seeing consistency in FDA responses. It's so, I think that regulatory people sometimes create their own bad press
Yeah.
by not making the effort to understand and all those things, you know, behind the scenes, and be creative with their strategy and their suggestions to the company and to the FDA, and to how to creatively navigate those conversations with the FDA and like a pre-sub or something of that
And
nature.
I was just going to mention, in US commercialization, we're extremely fortunate because we do have a free pre-sub process.
Mhm.
And it's a great way to position yourself for future challenges. I mean, there's a whole slew of why you should and shouldn't do pre-subs. Do not willy-nilly do pre-subs. I beg of you as a regulatory person, they can absolutely backfire.
Mhm.
But
Y-
as someone in industry who's working with small companies, startups, cutting edge, there is a mechanism available to us as the public, as industry, to kind of position ourselves very strongly. And I think there's so, sometimes there are some personnel in the industry on what regulatory and quality that's just like yourself, where it's almost a little bit fear-based and it's a little black and white, and really you have to find middle ground for all the players because otherwise you get stuck. And then you hear about medical device projects that have burned through 10, $15 million before they can make their first sale.
mhm.
And it's because there's just a lack of foresight on this middle ground.
So let's talk a little bit about proactive versus reactive compliance.
Yeah. I would say you see more commonly reactive compliance,
Hmm.
but it's much more, it can be much, much more expensive. I think a culture of proactive compliance ends up being a lot less headache at the end of the day, obviously.
Hmm.
I mean, QMSR is coming out. It comes out in February. I would hope that people are working on their transition plans already or have
That would
maybe.
be a great proactive thing to do.
That is proactive compliance, seeing what's coming down the pipeline and not hiding in the sand from it is important. And it's hard to get buy-in as like for a culture shift because it costs money to be
Hmm.
proactive up front.
Yep.
Whereas you're breaking the bank when you get 12 483s at the end of the day, right? Like, how do you get a company to buy into a proactive culture?
Right. And that's tough. To with that example I gave earlier about the reach transition, you know, anytime you can get the customer to drive the requirement, not just it's a regulatory
Yeah.
requirement and your regulatory person is the only one, like a prophet in the wilderness saying it's coming. But if the person who's writing the check is getting pressure from their customer, I mean, other way around. If the customer who's writing the check is making these requests and requirements, then your upper management is much more likely to support you. So you have to figure out all of these players and stakeholders and figure out what is the combination that's going to move your management ahead to action.
Yeah, it's definitely a huge challenge in industry because unfortunately EU MDR didn't do us any favors because it seems like people who were proactive almost got punished because of
Hmm.
the inconsistency of the reviews and the expense of the reviews. I mean, we're talking almost, I mean, well over six figures, maybe of $250,000 to get a review done for a product that's
Hmm.
already been on the market for $40,000. I mean, there's an astronomical amount of CE mark certifications being withdrawn, and now it feels even more challenging to get people to buy in on this proactive review, especially because I'll be honest, I think a lot of big companies either don't have the organization or the skill set or the personnel, and they wait to be reactive. They wait until they get a ding from an audit and they get a lot of recalls. And
Hmm.
how many times, like you said with Philips, have you seen the same recall?
Hmm.
And we even saw, we have an excellent uh presentation on the core pack recalls, and they came back up too a couple
Hmm.
years later after that huge incident. So there's kind of a call for industry and to be a regulatory rebel and find what is a good middle ground, because I think that's the only way that you can get like the
Hmm.
trust to invest
Yes,
ahead of time on a proactive approach to compliance, right?
that is a
You know,
great point. You have to, as a regulatory professional, build trust from
yeah.
your organization. so that
Yeah.
they'll move with you when you say it's time to move.
And that, I think, being, that's part of being in this new type of culture, and our approach to regulatory, and being a team player, not being a no man, and being a strategic partner. It helps us have those conversations because I'm not doing it to get you to spend money. I like, at the end of the day, I'm doing it because if you want to have a product in the market that my family can use while they're providing their medical services, it's only going to get there if I can convince you that you need to do this. Otherwise, I'm not the one shutting you down. It's FDA. Like, it's your clearances, it's your issues, it's your quality issues. Like, we root to succeed as a society and get these products to market. Like, we would make so much more money in another industry. Like,
We question our life decisions a lot.
there's easier, less stressful ways that don't necessarily lead to patient harm, but like, we do this because there's a passion to help people. And so I think when you talk to your regulatory team, maybe you should take a different lens sometimes and see why they might be saying no,
Mhm.
and maybe buy them a beer. They might just need it.
Depending on what happened, they might need a shot of tequila to go with it too.
Depending on what the day was like, they might just need a beer because, it's funny because when I do quality audits and as a regulator, I almost feel like I have the bulletproof vest because I'm taking it for the team.
Hmm.
And that's what I want people to feel. I want them to be able to, trust me to articulate what they're doing and field the audit off and represent our company well,
Hmm.
but also, like, you're like the frontline guard, and that's why so many people get very black and white
Right.
and fancy because they get shooed in and blamed for mistakes that happen.
Well, and I think in the industry as a whole, if you look at how regulations have evolved over time and what has led to some of the increase in regulations over the past 10, 20 years, is that people were taking that reactive approach. And so at first, if you look at the first, GMPs, QSRs, et cetera, that came out, they were very high level, weren't very overly specific. And then there were incidences that came out, in both the US and EU, where, then there was a public outcry that blamed the agency or governments. And so then you've got, public saying, hey, FDA, or hey, EU Commission, it was your job to keep us safe. And these people were running amok. And now we've got, all these deaths, all these faulty products. So then the government's response is, okay, industry, we gave you just enough rope, and all you did was hang your patient with it. Not even hang yourself, you hanged your patient. And so now we have to step up and do the job that you should have done and been accountable for that you didn't do. So then they have to start getting very specific. So, a reactive isn't just there, in terms of within the company, it having repercussions, with time, money, budget, compliance issues. But then as an industry as a whole, if being a reactive to compliance company is what drives FDA, other regulatory agencies to create more regulation.
Yeah, that's a great point, Michelle, that this reactive approach ends up impacting all of industry because you're setting the standard for how FDA is going to judge organizations. And they are going to say, you cannot self-police. You therefore need more regulation. And so it's more of us getting lost in the paperwork sauce of trying to do the right
Mhm.
thing for patients, but then having to dot every I and cross every T. And I mean that literally from paperwork that might not provide any value because there's so much fear that something new on the market is going to harm someone
Right,
because there's been serious compliance issues in the
right.
last, 20 years.
I like what you said about the paperwork sauce, because if we look at one of the biggest uh, uh, drivers for the medical device regulation in Europe it's a company called PIP. They're out of France. They were making breast implants. They made a change. You could go back, listen to the earlier episode. We talked about it in detail. But basically, the competent authority had to come in, and the competent authority found that they had changed their material, they had lied about it, and they had created false performance data for both uh, physical performance and for biocompatibility. And so that roll was rolling up all at the same time that the MDR was being, discussed and drafted and whatnot. Um, so the the MDR, which has come out like so overdone, like we took what used to be required for a CE mark, and I would say at least quadrupled the cost and time and effort and all of those things, at least quadrupled.
Yeah, I would agree.
And that includes the amount of documentation you have to turn in versus the MDD CE mark and the MDR CE mark. So if you already had an integrity problem and you already lied and falsified data when you only had to do this much paper, then you have to do this much paper. What is going to make you not lie when you do, and how much harder is it going to be to see the lies?
Catch the lies. Absolutely. When
Right.
there's this paperwork that doesn't mean what it used to mean, you
Yeah.
know?
So it's this cycle that self-fulfills itself.
Yeah,
You know?
it's definitely challenging.
Yep. So there's a huge ethics, argument to be had on the whole proactive reactive um, conversation, how regulations evolve out of that. Mm.
Well, I think this is a good wrap up for season one of Device and Conquer. We didn't cover this at the beginning of the episode, but I have not forgotten. So, when you have a 510K, we asked, what some of the vernacular we need to use. So, 510Ks, for your information, we get very neurotic about how we talk about this. 510Ks are cleared, they receive clearances. PMAs are approved, they're pre-market approvals. And then de novos, they actually get a classification request. You get a brand new product code that can be a predicate for others. So
Mhm.
that was from last episode.
Yep. And
And
to close this season, I think there's some of the key takeaways for you up and coming regulatory pros is that you need to build the product with the end user and patient in mind from the very start. That's where your user needs should start before you even have design inputs. You need to document every decision you make along the way, not just the final design. And you need to spell out your justifications and support them, scientifically. Don't treat your risk management as just a checkbox activity to turn in with your submissions or for your inspections. Bring your REQA team to the table early and actually listen to them. How, don't just invite them to the table for eye candy. So understand the requirements before you commit to a design or manufacturing process. Invest in training so your teams understand why these steps matter, and then be honest about nonconformities, what happened, where they came from, and fix them instead of hiding them or sweeping them under the rug.
yeah, I do want to expand on that because I think that there's a little bit, especially in this conversation, I think that there's almost a little bit of insecurity when you have nonconformities. Nonconformities happen. Everyone should accept that things will go wrong. That is part of being human. That is part of having a manufacturing facility or a spec developer, whatever. The important part that governments and everyone is going to really care about is how you respond to them. So it really is about dedicating the resources to fixing and preventing them in the future. I want to stress that because I think it's very important. And I think a lot of novices or younger companies think that one nonconformity is going to, shut the doors of the business. It's not. Unless it's like egregious. I mean, I guess
Mhm.
everything has to have a star asterisk these days. It's like,
Yeah.
Not for evil people that make poor decisions that hurt people. Like that's the
Mhm.
outside of this. But yeah, be honest about your nonconformities.
So just for some fun, if you ruled the FDA for a day, what were three things that you'd change?
Oh, I have to think about this. If I ruled the FDA, what are three things that I would change? Hmm. One, I would make them fix their databases. I think it has to be top of the list. The fact that it doesn't link anymore with the CFRs, the fact that there are all of these like broken hyperlinks and product codes and they're right out of the 90s. I'm not gonna lie. Like if I ruled the FDA, I think top of mind would be getting a concrete list of product codes, regulations, and a working database so that I could eliminate product codes that haven't had devices listed under them for 20
Hmm.
years.
Hmm.
So that again, we're not lost in like all of the data that is there that hasn't been scrutinized or reviewed in forever.
And one of mine is very similar, and that's the guidance documents that are around. Just total, first off, there's nearly 700 for devices, and some of them, were published in the 80s and it just are not scientifically relevant. And then, then there are other guidance documents that contradict, and yeah, that's just a mess. It's just too much to wade through to find what actually applies to your product.
Yeah, I mean, that would be my biggest change. I would fix the databases so that they link, and then I would want to take a look at every product code that hasn't had products under it in a long time because it's so easy to get lost in like a phantom product code that even FDA hasn't heard of. And
Hmm.
that does happen. There are product codes that we pulled out of the woodwork that they're like, oh, I haven't seen that ever.
Ever. I would similarly, I would put class one devices that are both 510K exempt and GMP exempt under enforcement discretion and not require them to register and list because
Yeah,
it's a unnecessary regulatory burden and unnecessary cost, and it adds like a unnecessary cost of goods to what is, you know lower
already
than a
established.
commodity product. And
Yeah,
because
already.
literally the only thing you have to do is pay what, 10,000-ish dollars a year and
Yep.
have a complaint procedure. And I've
Yep.
never one time seen an adverse event on a GMP exempt product. So
Yeah, I think that's a great one
I
too.
think that's a waste of regulatory oversight.
I also feel like I would like them to take a look at all the product codes that either were like class one requiring a 510K or class two not requiring a 510K and just make a nice universal decision across
Yep.
the line. Either they're class two to do
And
510K or they're class one and they're design control exempt. I'm tired of looking like because so many people want to see like the perfect slot machine of all the exemptions, your product code, your regulation, and it's so rare. It would be so much easier to not get people's hopes up and just say, "Oh, you're a class 1. I know what it's going to be. You're a class 2. You're going to need a 510K."
mhm. Yep.
Yep.
So
Is that it? Any other comments?
I mean, we could probably stay here the rest of the day and talk about things that we would change about the FDA. But, if you've got specific ideas of things that are under your skin and you only had 24 hours, what would you use them to do? So,
Or if there's something that you want to hear in the next season,
mhm.
Bites and Conquer, let us know. If there's a topic that you want us to go in more depth on, just tell us and we're happy to talk about it. Michelle and I talk all day long, and we clearly have lots of feelings about,
Yeah.
about what we do. So we're happy to shed light on anything that you have questions about.
Okay. Till next time.
Yeah, we'll see you in the next season of Device and Conquer.